In our continuing coverage of diabetes-related disorders, today we have a very special guest, Dr. Ashish Mathur, who is a practicing nephrologist, and more importantly, he is part of Braun, which is a company which is a market leader in hemodialysis equipment. So today, we are also going to ask him, in addition to all the issues related to kidney disease and diabetic nephropathy, we'll ask him a very important question which you have sent us so many times. Many of our viewers and readers have sent us this question, and that is how to get the best out of hemodialysis. Thank you so much, Dr. Mathur, for being with us. It's a delight.
Thank you for having me. Thank you for having me.
So first of all, let me get to the basics of it. One issue which diabetics often ask is, why does diabetes cause nephropathy in the first place?
Okay. Diabetes is a disease which actually affects very smaller arteries, and there are three organs in the body which have very small and thin vessels: the eyes, the heart, and the kidneys. So because of that, these are the three organs: the eye, the heart, and the kidneys. They suffer first of all, and kidney is an organ which is full of smaller arterioles and venules. That is why diabetes is primarily responsible for causing nephropathy.
Can you tell us about the latest technologies in dialysis these days?
The field of hemodialysis and dialysis per se has changed tremendously in last couple of decades, I would say. In terms of purely technical advancements, the machines have changed, the water treatment units have changed. So what in dialysis we called is a tap to patient approach. So starting from the water quality, it has undergone a massive change. The water quality has really improved. There is ultra pure water available in most of the places. The machines have become volumetric, so the machines usually don't remove more fluid than required. Especially if there is a Braun machine which has a volume control on itself, that even if the blood pressure goes beyond a limit, the machine will stop removing fluid from the body.
Goes below a limit.
Either below or above a limit. The machine adjusts its ultrafiltration, or what we call removal of water from the body,
So which
automatically.
means that even blood pressure is connected to the machine?
Yes.
It's constantly
Being monitored. So, and all the machines in a center are connected through a software. All the patient data is already in the software.
Okay.
The machines know what sort of therapy is to be delivered to a particular patient day after day. A nephrologist sitting 100 kilometers away or in some other continent can actually manage the dialysis through a laptop. The advancements are huge. There is a whole therapy data management system, or NextCD as we call it, which is available. So the advancements are huge. There is a lot of clinical advancements which have come up. A lot of medications have improved. The pharmacology has improved. Better care is being provided now. A lot of people are getting trained in nephrology. A lot of people are getting trained in dialysis.
Very true.
Dialysis, which used to be a facility available only in the bigger cities of the country, 4 metros, is now actually spreading out to the interior parts of the country, especially in states like Telangana or Andhra.
Doctor, what are the advantages of doing hemodialysis over peritoneal dialysis? Because there is always a debate going on in patients, which is peritoneal is better and hemo is better, and what actually is the situation?
Clinically speaking, there is no advantage.
I see.
Both the therapies are absolutely equal, at par with each other. It's a patient's choice.
Okay.
And patients actually decide with their clinicians what sort of therapy they want. In some clinical cases, in some patients where the cardiac conditions are not very good, the caregiver may ask to go for a CAPD. But technically speaking, there is no advantage of a hemodialysis over a peritoneal dialysis. Both are equally same.
Okay.
And the cost-wise, both almost comes to be equal.
Okay. Okay. It's probably the convenience that is slightly...
Generally speaking, in North America, or for that matter even in our country, India, 90% of the patients, they go for in-center hemodialysis instead of a peritoneal dialysis. There is a lot of emotional connect involved with their caregivers. Patients feel more comfortable inside a hospital setting. The caregivers, the clinicians are more confident because they see their patients regularly. So a lot of
Which
these
is actually
issues,
very important.
which is important,
Very
which is
true.
important.
Very true.
And with our infrastructure and with our facilities, if there is an emergency situation, then the patient is well taken care of if that patient happens to be inside a
Center.
hospital setting rather than being at home.
True. Very true.
So this is the advantage hemodialysis in our country seems to have over peritoneal dialysis.
Doctor, my next question is about, there is also a practice of doing nocturnal dialysis, which is picking up very fast. Can you explain exactly what is nocturnal dialysis before I ask you what are the advantages of it?
Nocturnal dialysis is a concept which is coming into the country where patients go for dialysis during the night. On an average, a dialysis clinic works from morning till evening and then it closes. Or it takes up patients only who are inside the hospital with an acute emergency.
True.
Nocturnal dialysis is a concept, where a patient comes in to the hospital only to get a dialysis during the night time, where the dialysis time is increased. So from an average of 4 hours dialysis, the patient may end up getting 6 or 8 hours of therapy.
So it increases efficiency?
There is a concept that it does increase the dialysis time and the toxin levels, what we call inside the blood, goes down much further than what goes in conventional therapy.
And it can be slower, which is better for the body.
It can be slower. So it depends upon the patient condition and it depends upon what the physician wants to do with the patient and what are the requirements of the patient, the body size, the weight. So, and what are the other comorbidities involved?
Doctor, if people can afford it, can they do nocturnal dialysis at home?
North America is doing a lot of nocturnal dialysis at home, but it involves a lot of effort from both the sides, from the patient side and from the caregiver side.
Okay.
The patients have to learn some therapy concepts before starting this therapy at home. They have to learn some nuances. They have to.
Are you trying to suggest that you can do it without a technician?
No, that is what I'm saying. You have to learn few things, because even if a nurse or a technician who does the dialysis at home during the night, if that person needs some help in the time of an emergency, there should be somebody available from the patient side to actually help them. Or 2 people have to go and do the therapy every time.
Okay.
That is one thing.
Okay.
There are some purely technical things which are required, like good water quality has to be provided for dialysis. So a water treatment unit has to be established.
So RO plant has to be installed?
Yes, a water treatment plant has to be established at patient's place. Purely infrastructure wise, the cost wise, the machine has to be placed there permanently.
Doctor, before you proceed, nowadays there are lots of water filters available where they say it's an RO plant. You think that kind of equipment, that kind of water filters can also be used for dialysis?
The conventional RO, which in Indian setup we say it's the RO which we put in our kitchens.
Correct. That's what I was referring to.
That
Hemamalini does it so.
Yeah, a lot of people are now advertising, but
Correct.
That's a portable RO.
Right.
That's for drinking. For dialysis, you need a totally different set of water treatment unit, which is huge, which requires to remove a lot more impurities from water than in conventional drinking water RO would do.
I see.
Now, please understand that during a 4-hour dialysis therapy, patient's blood is exposed to more than 200 liters of treated water. So, if that water is impure in any way, then a lot of those impurities will pass on into the blood.
In one session, 200 liters of water is passed through? Acha.
The blood comes in contact with
I
huge amounts of water, which is a treated water. And to create that sort of a treated water, lot of raw water is required.
True.
So the water needs have to be met.
The
For an
quality of water
optimum-
has to
the
be
quality of water has to be good. The personnel who is doing it has to be trained. The patients themselves have to be motivated to that level. In countries outside India, a lot of patients put their own needles for dialysis. So, they prick their own fistulas. So
Wow.
the advancements are coming. The patients are also participating. It's the mindset which needs to be changed for such therapies.
So you're suggesting that if somebody really gets trained, they can do it themselves?
A lot of people are doing it themselves.
Oh, acha. Okay. Doctor, what is the price of a dialysis machine first for a hospital or a center? How much will that be?
There are many varieties of dialysis machines which are available in the country, and an average cost of a dialysis machine starts from somewhere around 4.5 lakhs to 6 lakhs per machine.
Okay.
So that's for conventional dialysis. There is an advanced machine which is now coming into the country for last few years,
Okay.
which delivers a special therapy which is called online hemodiafiltration, which is a slightly advanced form of conventional hemodialysis.
Okay.
Uses a different technique. That machine costs somewhere around 8 to 10 lakhs rupees.
And what is the difference in that?
This machine does hemodiafiltration, so there are a lot of technicalities involved, starting from the water supply to what happens inside the dialyzer or the artificial kidney,
Okay.
we say. So the basic principles involved in a conventional dialysis is through diffusion, whereas this does diafiltration, so it's diffusion as well as filtration. So a lot of technicalities have improved,
I see.
so the costs are going up.
The efficiency of dialysis also will be better?
Yes, it is said to remove lot more toxins and other things than a conventional hemodialysis does. So yes, it is beneficial in a way, and currently it costs more.
I see. And for individuals who want to have nocturnal dialysis at home, how much will that cost?
If you talk about cost, we have to talk about a lot of things, starting from a water treatment unit to the plumbing arrangements which need to be done, the electricity requirement, the machine cost per se, the consumables, and the personnel who would go at night and do it. On an average, say in a city like Mumbai, where you can get an average dialysis in any center for about say 2,000 to 3,000 rupees.
Okay.
Or in Delhi, you would get between 2 to 4,000 rupees in a very decent place. Add to that the cost of these consumables, which would cost around 1,000 or 1,200 rupees per session, and 500 to 700 rupees for the nurse or technician, which would come down to the place and do the dialysis. So if you add that up, one session would...
So are you trying to say that the patient does not have to buy a machine at home?
There are different models which people are working on at the moment.
Oh.
There is a
What
model
are they?
where the patient would end up buying the whole equipment. There is a model where patient can take all this equipment on rent.
I see.
And there is a model where a close community, gets together and buy few machines or take them on,
I
lease
see.
basis and use them for their own purpose. And there is a model where you give a set of patients and people like us go and put up machines for a pay per therapy sort of model.
I see.
So you put up a machine and assure us.
All this is prevalent in India?
It is very much available.
Yes, doctor. Can you tell us about the advantage of doing quality dialysis?
That's a very good question you have asked, because for last few years, a lot of talk inside the country is about dialysis and its cost. A lot of mindset, starting from the government side to the caregiver side, is being in the direction of reducing the dialysis cost, which is fair.
True.
But nobody is paying attention, a lot of people are not paying attention to what sort of quality we are providing. It is very important to give a good quality dialysis. For example, for a patient to survive on dialysis in Germany for 20 years is normal. For a patient to survive for 15 years on dialysis while that patient awaits for transplant in North America is pretty okay. Whereas in our country, to survive on dialysis for 5 years is a big task. Patients usually don't survive. The question is that we are probably, as a country or as a society, are not providing that quality of dialysis. And if you want to provide that quality of dialysis, it's definitely going to cost something. Because
in terms of equipment, in terms of services,
in terms of equipment, purely in terms of personnel, purely in terms of how you tackle the comorbidities.
Oh.
Predominantly in our society, the patients pay out of pocket for dialysis.
True.
Please understand, this is a costly therapy, and the resources are drained faster than one would imagine. And then patients are left, or the families are left with no choice but to compromise
on the quality
and go for a dialysis which is cheaper. So that raises a lot of questions, what the government should be doing, what the society per se should be doing.
Doctor, you have been working in all these rural areas, mofussil areas. Two questions coming that. Before I come into the issues related to interior parts of India, what kind of government policies can help kidney patients who are on dialysis?
Fantastic question. We have been providing dialysis care in 3 states in the country at the moment, which is Andhra Pradesh, Telangana and Bihar.
I see.
I would give an example of Andhra Pradesh and Telangana, where they made the government of erstwhile Andhra Pradesh, now it's Telangana and Andhra Pradesh, they came up with the Rajiv Arogyashree Trust. And they ensured the whole population of the state, which was below poverty line. The government would pay the premium, all the population below poverty line is insured. So if a poor person in Andhra Pradesh or Telangana who has that card, Rajiv Arogyashree Trust card, can step into any facility registered with the Arogyashree Trust and get therapy and simply walk out without paying a single penny. So
that's absolutely unique.
6 or 7 years ago, when this program was started, the state of Andhra Pradesh was doing dialysis, but 90% of that dialysis was being done in private centers like Apollo or other players. With the beginning of this program, the people who used to get dialysis in private setup remained the same, but more than that number started getting dialysis under Rajiv Arogyashree Trust and Braun.
Okay.
And the peculiarity of this program was that the centers are majorly into rural areas, in smaller districts, in smaller towns.
Okay.
Because for a patient to travel a long distance, spending a lot of resources in traveling, getting dialysis done and coming back was a huge burden.
That's all the add-on cost.
That's the add-on cost. So we removed that add-on cost. We made the dialysis free for the patient per se. The government would reimburse that. And the program is hugely successful. There are patients which otherwise would not have even known that they had renal issues or would have died, are now surviving for more than 6 years in our system.
Doctor, there are again two issues here. First thing is that is there any idea of mobile dialysis, where it could be instead of patients coming to the center, it could be a mobile unit which goes around to do.
There are people who have tried this in India, and there were attempts made, but there are purely logistical issues involved with it and some medical legal issues involved with it. So this thing has not actually been very successful in the country.
Does it, is it prevalent abroad in the advanced world? Doctor?
Not so much.
That also leads to a question that, in India, we reuse the dialyzer, in some hospitals I've seen 15 to 20 times.
Yes.
But in the advanced world, it is not more than once. But even now, they have started to realize that reusing a dialyzer is more efficient than just using it once. What's your opinion on that?
Yes, there are a lot of mixed views on that.
Yeah. Yeah.
Especially with the dialyzer reuse.
True.
For example, especially with Braun, we do not reuse the tubing. We never reuse the blood tubing.
I see.
And when it comes to reusing the dialyzer, we do not reuse it manually. We only reuse it in an automated machine. Now, if you look at a dialyzer, it has got millions of fibers inside it,
Correct.
through which the blood runs. So we call it a fiber bundle volume. If one has to reuse a dialyzer, then there should be a minimum bundle volume which should be intact. What happens is that during dialysis, some of these smaller fibers get damaged or
True.
are not functioning as desired. The automated machine actually measures the number of those fibers and gives a figure at the end
You
of
mean
it.
to say your dialyzer actually would tell you if the dialyzer life is over?
The machine will tell you how much of the fibers are still intact and functioning normally. So some people keep it at 75 or 70%.
Mm-hmm.
Beyond that, the machine would automatically discard the dialyzer. That is what we follow in our Braun clinics.
Mm-hmm. Mm-hmm.
If we reuse the dialyzer, we reuse it till it is automated and the machine tells us to use it. It depends upon the patient's condition, it depends upon the typical biochemical parameters of the patient. If the dialyzer has to be discarded after second use or third use, we have to discard it. And in some patients, it goes up to even 15 times, as you have been saying. So it's all evidence-based and scientific.
That means it also depends on the patients.
It depends upon the
You
condition
can't
of
have
the
a
patient.
thumb rule.
You cannot have a thumb rule on it. You cannot fix up a figure that we will reuse it for 6 times or 8 times or 3 times. No. If it's there in the machine clarifies it, we can reuse it again. Otherwise, we have to discard it. There are some peculiar biochemical actions going on inside few patients where the dialyzer has to be discarded much earlier than others.
Mm-hmm.
And in some patients, it goes on for a really, really long time.
It goes on for a really long time. Thank you so much, sir, for being with us.
Thank you so much for having me.
Yeah.